The sky might have the stars, the sun might have the moon. I heard somebody saying it could all be over soon. Please don't break my world. Please don't break my world. Please don't break my world. 'Cause this is where the living's going on. So please, 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 please don't break my world. Remembering a season, thinking of a time, trying to get back to a reason and a rhyme. Please don't break my world. Please don't break my world. Please don't break my world. 'Cause this is where the living's going on. So please, 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 please don't break my world. Please don't break my world. Please don't break my world. 'Cause this is where the living's going on. So please, 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 please don't break my world. Don't do it. Man, I'm saying don't do it. If you ain't seen from the eyes that seen, then you ain't real well been. Don't judge me. Don't do it. Man, I'm saying don't do it. If you ain't seen from the eyes that seen, then you ain't real well been. Don't judge me. Sige na, kilalanin mo ako. Teka, how can you judge when you don't even know what I've been through? Yeah, it's been a sequel of yesterday. No, they don't see me as an equal. Is it my tone, the skin, my melanin, my stilo, my fate, my genes? Dame un momentico to live, to breathe, to a better tomorrow. We're more alike than you thought. Though I may look like a threat to ya, I really wanna just work so my family good. But like every day, somebody blasting me, saying that I don't belong, screaming and blasphemy. That I'm a sinner, but really I'm a breadwinner. That I'm a criminal, really I'm a dope singer. No, not a slinger, I'm really not a street slinger.
everybody, I'm Dr. Joe Nyamtu coming to you live from the Aesthetic Show 2018, and I want to welcome everybody. So last night after the sun went down, it was only 105 in Las Vegas, all right? So it's hot as hell here, but it's really hot inside this chamber, and I'm not talking about temperature, I'm talking about with the buzz that's happening at this meeting. The Aesthetic Show has a lot of energy, and we're live, and people are buzzing around, going from course to course and eating lunch. And today we're with Dr. Ryan Welter. And Ryan, tell us a little bit about who you are and where you're from.
Well, first of all, I'm very happy to be here. This has been an amazing conference. It's been a great time, and there's just so much going on in the field of regenerative medicine, which is where I'm at. We've had several sessions now here at the Aesthetic Show on regenerative medicine, and I think that it's just starting to educate doctors and patients about what a life-changing landscape that is. So I'm from Boston. I started New England Hair Restoration and then a company called Regenerous Medical, and now we focus on basically life-changing cell therapy to help rejuvenate skin, which has just been amazing, and then also therapeutic applications as well. So it's been pretty unbelievable. You know,
there's two things that I notice when you walk around this meeting, and also being old and have gone to meetings for 3 decades, is that, you know, you didn't have this stuff, obviously, 20 years ago or whatever. And, you know, the older meetings, you had surgeons for the most part.
That's right.
Because there was not non-surgical stuff. And then you had your core specialties. But today, with the regenerative medicine, it seems to have encompassed a lot more people, a lot more specialties, you know, surgical and non-surgical. And so
I think that's exactly right. I think cell-based therapy is changing how we're practicing medicine. What I used to tell people is that it used to be basically, you know, drugs and surgery. Those are your options, right? That's all you could do, apply something or surgically fix something. Now we have cell-based therapy. We use platelet-rich plasma. We use fat grafting. We do stem cells from fat. And all these things are basically working from the inside out to actually regenerate your cells. And, you know, the lifespan is getting longer. And not only is the lifespan getting longer, but the quality of our lifespan is getting longer. And
right.
I think if you're if you're a patient now, and you want to avoid knee surgery, or if you want to have a face that looks young, you know, I'm 47 with 8 kids, you know, and I mean, regenerative medicine is, and what we do at Regenerous Medical is huge, because stem cells are changing people's lives, keeping us younger, keeping us active, keeping us being able to do what we want to do longer.
You got anything with you could put on my head?
Yeah, that's right.
All right, so a couple questions. Like, you know, you can't just come to a meeting and go do a facelift, or come to a meeting and go do a tummy tuck. But so for people that are interested in getting into this type of regenerative therapy, talk about 2 things. Number one, what specialties, or is anybody qualified to do this? And how do you go about learning this and integrating it into your practice?
It's funny you say, because the talk I just gave was how to integrate regenerative medicine into your practice and teaching doctors how to do it. It's actually so easy. A good first step is platelet-rich plasma. I'm sure you've had some experience with that.
Sure.
Really easy to use, low-cost entry to get into. There's a lot of great organizations providing that kind of turnkey. People like Healing on Medical, they do a really good job. And then as you learn and use, say some of the blood products, which are easy to get and easy to deliver, you can work yourself into something like Almi, which is fat, and then stem cells from that. And companies like myself with Regenerous Medical that have training facilities. We have doctors from all over the world come, we give them a training, and then they learn how to do all these applications. So there's a lot of ways to get into it. You do it stepwise, and it's not that difficult to learn. It's really great.
And so you have
life-changing for patients.
And you have courses.
And we have courses, exactly right.
And you know, the other thing that I notice is there are so many procedures that you would see standalone, like microneedling and things like that in the past, and now they are combining
coalescing. Yeah, they're all coalescing
with regenerative medicine.
Yeah, that's exactly right.
So you hear so much buzz about stem cells.
Yep.
And you know, some of it is a little misleading.
Yep.
I mean, because everybody's doing stem cells and this. So talk a little bit about what really a stem cell is, and the advertising that people are doing about it. How do you know if you're really getting that?
I mean, that's a difficult question. I think you, as a patient, I think you need to do your research, make sure that the people that you're going to see have a background and training in what they're doing for one. Stem cells, though, are all over. We have a couple million stem cells per cc of your own fat, so adipose tissue has been a great source. Bone marrow is a good source. So we call autologous or same self, getting tissue from yourself and bring it back to yourself. Those are real stem cells, and they really do have activity that can help elicit change in your body. We see that with platelet-rich plasma as well. It's just your cells activated, releasing growth factors. But there are a lot of off-the-shelf products now from stem cell serum that have growth factors itself. There's also matrices and things that are devoid of stem cells that they will say sometimes are stem cell therapy. These are sometimes more like matrices that will infiltrate with your own cells at some point, but aren't really stem cells that you're giving to yourself. So there is a lot out there. The patient does need to get educated. And I think the most important thing is to find and seek, like anything in medicine, as you know, the right thing is to find the right doctor and the right person who has a good education to get you in the right direction. Right.
So in terms of safety of these therapies, is this something that you can have complications with, or is it?
There's lots of different levels of therapies. You have platelet-rich plasma, which is just a simple blood draw. Really nothing adverse with that. It's just your autologous. If you're going to do stem cells with fat, for example, you do have to have a minimal liposuction just to get some fat. You don't need a lot, just 10 to 20 cc's. But it's anytime you put a needle or something in your body, you can have bleeding or infection and that sort of thing. But to date, really, no significant abnormalities with the cells themselves being added. I think some people have done some really strange applications that have made the news, like putting stem cells in people's eyes and things like that. I mean, those, if the doctor isn't doing the right thing, then you're going to have complications. But right now, what we see with the cell therapy, it's extremely safe because it's your cells doing that. And that's what people are looking for today. I'm sure you see that in your practice and what you're doing. They want less of the toxins and less of the things that are being sold and pushed to them, and they want more natural alternatives. And that's where cell-based therapy really, I think, is making the most headway, because it's your cells and it's your activation that's doing the work. We're just really, as doctors, mediating that process.
Sure. So interesting. Now, are 100% of your applications aesthetic? Do you do any functional things with these stem cells, joint injections?
Yeah, so my history was I started actually in hair. In 2011, I did the first stem cell hair patient that I know of. We had really good results of that and started to build off of that, started to do some studies, started reporting what we were seeing. We did alopecia universalis and alopecia areata with good results, again, combined with PRP. And then once you have a hammer, everything becomes a nail, right? So we started to look at knees and joints, and now I have a bunch of patients that I've done their knees with. They've all done. They come in. The last patient that I had a testimonial come in, he was a executive at Dell. He travels all over the world. He's on the airplane. He said, I couldn't even get into the airplane because when the pressure changed and everything, he was going in for surgery a week later, and he had a stem cell knee done. He's been doing great now for 6 months. It's really mind-boggling how amazing it is, so it's been exciting.
I know we really can't predict the future, but just looking at the past 10 years of, the changes that we've seen, and, we're here at an aesthetic meeting and we're talking about knee injections. Where do you see this going?
It's pretty amazing. Yeah, that's exactly it.
Yeah, where do you see it going?
I've been doing drug research with drug companies for many, many years now. And all of their pipelines have changed from drugs. We need antibiotics, no one's making any, but we need some. But no one's making drugs. They're all doing biologics. So I got Pfizer coming in with biologic studies. I've got Amgen, all these people coming with biologic studies. No drugs, it's all biologics. It's all, antibodies and immune therapy and all these types of things. And cell-based therapy now is really the frontier of medicine. A single cell will release, thousands of different growth factors, the cell cytokines and things. We don't really scratch the surface. How are you and I going to know when to use a growth factor? Yeah. We really need to have the cells there kind of telling us how to do it. Yeah. And using that activity and turning things on and off a little bit of marionette action, but really at the cell microscopic level, it's the cells that are doing the work. We need to, why do a growth factor serum when I can have the cell basically be that conductor for the entire growth factor orchestra, really, And so that's what we're seeing, and that's how that's how cartilage is being developed in knees and things like that from these cell-cell interactions.
That's fascinating. Really and so we have about 30 seconds here left. Yep. You been to the aesthetic show before?
Oh yeah,
I know that because I see you here a lot. So. Tell the people out there what's different about this show. Why do you like it?
So I think if you are looking for some of the cutting edge technologies in aesthetic medicine, otherwise, you want to come to the aesthetic show. You're going to meet some of the leaders in the field, the top leaders in the field, and you're going to learn so much. And you're going to see, just like we were talking today, beyond what's going on in aesthetics, which is game changing as well. You're going to see what's going on in other fields of medicine. And I tell people with my lecture on regenerative medicine, you start regenerative medicine, it's going to change your practice, but it's also going to change your life because you're going to be an adopter. You're going to start using the technology. You're going to start seeing what other people are doing, and you're going to bring that to your practice and do very well.
Ron Welter, regenerative. Thank you so much for being with us. All right, good seeing you.
All right.
All right, ladies and gentlemen, here we are, the 2018 Aesthetic Show live in Las Vegas, Nevada, baby. Nevada, there's a V in there, it's Nevada, actually. And so we have guests today, Mark White, Judson Bryce, and what's that?
Dr. Brandeis. Brandeis.
Brandeis. Man, you know, I've been up here all day. Sorry about that. And from Gainswave, which we're going to talk about in a minute. And so, again, the thing about the Aesthetic Show here, and these guys will tell you, they'll second this emotion, is that you have so many types of doctors and ancillary personnel, and you have these hallways. We're at the Wynn Hotel, a very big place, and we're taking up this whole convention center. And you have on the right and left, I mean, you have practice management, you have injectables, you have surgical things, and it's just a wild experience. Gainswave. Okay, who's going first?
I'll start.
Tell me what it is.
Well, Gainswave is a brand that brings awareness for an amazing procedure that will help patients connect with their partners without the need for any medications. So we help patients connect with partners, and we also help connect patients with physicians.
Okay, and how do you do this? What's your platform?
So we use shockwave therapy. So it's low intensity shockwave therapy. It just requires local numbing cream. We do it in the office once a week for 6 weeks. Patients are totally awake, they're totally comfortable. And the shockwave therapy, basically, it tricks the body into creating inflammation. And that inflammation results in a healing response. As part of that healing response, you grow blood vessels. And those blood vessels increase blood flow to the penis, and it creates better erectile function.
And so tell us about your average patient that comes in and what they're looking for, what their complaints are.
Sure. So a lot of our patients in the urology clinic are patients who have been taking Viagra, and unfortunately Viagra or PDE5 inhibitors no longer work for them, or they work really poorly. And so we administer shockwave therapy, and by the time we're done, after 5 or 6 weeks, Viagra is working great for them. And sometimes we can even get patients off medication, totally
off. Interesting.
Restores spontaneity in their lives.
Sure.
And totally restores the connection that they have with their partner.
There's no doubt about it. Now, the shockwave therapy, is that similar to the kidney stone?
It's the same technology, except that the public has not heard about this yet.
Right. So let's tell the public a little bit about this. And you know, we're at a medical meeting, so we can talk about what we need to talk about. So how do you do this? The male patient comes in, and what happens?
I'll let you go, doctor.
Sure. So for example, kidney stone therapy, it's the same type of shock wave. It's not a sound wave, but a shock wave. But when we break up kidney stones, which urologists love to do, it's 100 times more powerful than these waves. These waves are low intensity shock waves, and what they do is they stimulate the blood vessels. And so basically we run the ultrasound probe over the penis and also the perineum. So what you really want to do is get the blood vessels that are going into the penis, as much of those blood vessels as you can possibly get. So when they go through the perineum and then up through the penis, you basically want to stimulate those blood vessels wherever you can get them.
And does this cause any new vascularity as well?
Absolutely.
Neovascularity?
It cleans out old blood vessels and it establishes new blood vessels.
And how long does the treatment take?
Each treatment takes about 15-20 minutes.
And what is the sequence? How many times do you do this?
Once a week for about 6 weeks. And patients can expect improvement in about 4 weeks, right? Because it takes a little while to grow new blood vessels.
You know, I think it's amazing. You came to these meetings 10 years ago, and you really didn't hear much about male or female enhancement or rejuvenation or these functional problems, and it is such a hot topic today. And one of the great things about this meeting, as I've said many times, is you have people that do surgery and they just get their hands bloody, and you have a lot of other people that are helping patients with non-surgical techniques. And this was almost you know, over the last couple days here, we've had a lot of people coming up here talking about vaginal rejuvenation, penile enhancement, and they were almost taboo topics. Now, how do you market this? Because it's a little bit discreet. How do you market it?
See, guys don't like to talk about it. Women, it's all a lot of word of mouth, but guys don't go up to their friends and say, hey, I can't get an erection, what do I do? So they research it on the internet. Digital marketing is very big. Videos, educating clients is very big, and that's what we're really good at. We've built a brand, and by using the power of branding, we're able to tell people about it. We're able to get the word out. We're getting our doctors on TV shows. Dr. Brandeis, who's an amazing urologist, is going to be on the Doctor Show in the next couple weeks, and that's how we get the word out. That's how it spreads.
You know, Joe, the other thing that we do is patients love to share their stories. So I have a patient, I've been treating him for 15 years. His wife had Alzheimer's. He's been taking care of her for 10 or 12 years. Finally, she passed. I would see him once or twice a year for 15 years. And then after she passed, a year or two later, he got a girlfriend, but he wasn't able to physically connect with her. And we gave him GainsWave. And after the 5th treatment, he came in. His cheeks were all flushed, and he had a big smile, and he started hugging everyone in the office. And it was just, he told us a story about how he had physical connection with his girlfriend for the first time in 15 years. It's really an incredibly rewarding thing when you can give somebody that part of their life back.
Yeah, and it's amazing. And I mean, you know, as people live longer, being sexually active is huge. I mean, when the lifespan was in the 60s, you know, it was probably less important. So what would you say is your average age of treatment, or is there a big range?
You know, in the urology practice, our patients typically are 60 and above, but really 50% of men over the age of 50 will have some degree of erectile dysfunction. So really anyone 45 and above, their erectile function and their testosterone levels are starting to decline. And this will give those patients a boost.
Is this a painful treatment at all?
Absolutely not at all.
Okay.
And after treatment, patients can go to the gym, they can have intercourse that night, whatever they want to do. It doesn't interfere with life in any way, shape, or form.
Now, who kind of developed this technology? Do you have something to do with this?
Well, the technology's actually been around for 20 years.
In this application?
In this application, there's clinical study after clinical study. We've identified over 70 studies that show that it's safe, effective, and there's not one documented side effect. However, the story had never been told, because if there is no brand behind anything, if you see anything and there's no brand behind it, there's no consumer demand.
Sure.
So I developed the consumer demand using the same tricks that pharmaceutical companies use. Getting a brand out there, letting people know about it, and letting them know that there are amazing doctors like Dr. Brandeis that will treat the patients.
So, one of the neat things about what you guys are doing here is it kind of markets itself, because it's, you know, who doesn't want that, right?
Yeah, what guy doesn't want a better erection?
After the meeting. So you know, it is. I mean, it's trendy. Now, you're a urologist, so this is right in your bailiwick.
Absolutely.
But is this something you only want in the urology community in terms of doctors delivering this treatment, or is this something you see going into, you know, primary care or whoever? I mean, who's going to be qualified to do this?
Right. So the anti-aging physicians, a lot of them offer this as well. The advantage of a urologist is that we offer the full spectrum of services, from pills to shots to implants. So a key to this is offering it to the correct patient. So for example, the patient who has prostate cancer who's had non-nerve sparing surgery, this isn't going to work. Or a patient who's a severe diabetic that's been injecting insulin for 10 years, it's not going to work. So you have to select patients properly, and you have to set proper expectations. And if you do that, it's amazing. Patients are so happy. It's so rewarding to have these patients come back and give you a hug or give you a high five, or just having them in the practice. It's really, it's invigorating.
Well, you know, from a corporate standpoint, and you already know all this because you're a corporate guy, but I think one of the biggest problems that companies run into is what Dr. Brandeis just said, is that people are using something for an incorrect application. And, you know, like for instance, Kybella that you inject for fat.
Right.
You know, if you have a little tennis ball of fat, you inject that and it'll help it. If you have skin, it's not going to help it. So people are going to go, they're going to get Kybella from a misdiagnosis, and they're going to say, that doesn't work.
Right.
And they're going to go online and they're going to say negative things. So you need to really make sure that you guys market the fact that what's an appropriate patient, and all of your people that deliver these therapies are doing it the right, because otherwise that could cut you off at the knees.
That's another benefit about being a GainsWave provider, is that you're working with 250 of the brightest minds, and you're able to talk to these doctors. Before you can become a GainsWave provider, you go through a 2-day training course. Once you're a GainsWave provider, you can connect with top urologists, OB/GYNs, age management doctors, and learn what they're doing.
Sure.
So you're not doing this alone.
And you know, Jill, there's one other thing that we're doing that's really, really important, is I'm working with GainsWave on creating a national registry study.
Yeah.
Right?
Yeah.
So that, because this really hasn't been studied enough.
Great.
And so what really we need to do is to get thousands and thousands of patients to submit data to a central repository.
Sure.
And I'm working with UCLA,
Right.
and I'm working with Cleveland Clinic on organizing this. And it's important to know who it works on,
Sure.
but also it's important to know who it doesn't work on.
Gotcha.
Because we don't want to waste people's time and money if it's not going to work.
Gotcha.
And it's going to help us identify who it works on, who it doesn't work on, and if it doesn't work on certain people, what other things can we do to
Right.
restore their quality
Well, you know,
of life?
the science is always integral. We're running out of time, but I want you guys to do me a favor. I want you to come back next year. We'll sit at this desk, and you can tell me where we've gotten in 12 months, all right?
Absolutely.
Mark White, Dr. Brandeis, thank you so much.
Thank you.
Enjoy the Aesthetic Show.
Thank you so much.
Thank you very
My
much.
pleasure.
Man, great time up here. The 2018 Aesthetic Show live in Las Vegas, Nevada. And that was a very interesting talk. One of the really cool things about sitting up here at this desk is I'm learning a ton about these new technologies. So we have Bruce Allen and Melissa Silvestre.
Yes.
Right? Did I do it right?
You
'Cause
did it
so far,
perfectly.
Good.
welcome. So far, I'm missing
Thank you.
all the names,
Nice to meet
okay?
you.
Good to meet you guys. And are we resetting the timer for me, people? You're making it tough on me. Gosh, this is a great show. I hope you're enjoying it. You guys have been here before?
We have, yeah, it's incredible. This is an incredible show.
And what's your favorite thing about the Aesthetic Show?
Honestly, learning all about the products that they have available.
Good. Move your chair over a little bit.
Okay.
Come in a little tighter here. And all right, guys, so I want both of you to start one at a time and tell us about your roles and what do you do here with this. And
Okay, I'm Dr. Bruce Allen. I'm a gynecologist up in Calgary, Canada, and I do general obstetrics and gynecology. Very big into urogynecology, but also do cosmetic female gynecology as well. I have a center I call the Allen Center in Calgary, Canada, and I've been using a Viviv system for the past 6 years. I've been very involved in some of their clinical trials, and I initially purchased it because of the strength of the evidence. It has a lot of scientific evidence behind it, and I've always said that I will not introduce anything into the Allen Center unless there's strength of evidence behind it.
Viviv, I like that name. Is that Viviv.com?
It is, yes it is, Viviv.com.
That's a catchy name. Did you come up with that yourself?
That was not me, no, I can't take credit for that.
All right, so let's hear from you.
I come at it from more of an emotional component. As you can imagine, I didn't plan on having stress incontinence in my 30s. However, after 3 children, I did. And so many women at some point in their life start to focus back on themselves and realize that they too have stress incontinence, right? Through diet and exercise, they try really hard to lose that weight after having babies. And they realize that they can't get through an entire workout without peeing their pants.
Yeah.
It is what it
Yeah.
is, and
Yeah.
other than, you know, Kegels and surgery
Sure.
and pads,
Sure.
now Viviv has technology that works, right?
You know, Melissa, that's and I think a lot of males don't realize this. A lot of males that are married to females that may have this problem. So in my office, I work with all women, right? And we're doing cosmetic surgery, and it was a medical thing, and so our conversations are pretty open. And it shocks me how many young women are in public afraid to sneeze, afraid to bend over and pick something up, afraid to be in a workout class. I honestly had no idea that it was that prevalent. Now, correct me if I'm wrong, but the previous surgeries done by your specialty or urologist, the mesh surgeries and things like this, I mean, these are pretty big procedures, right?
They are, and what I've found over time, I've done a lot of TVTs, I've put in a lot of meshes, and I find they are very effective. But what's happening over time, women are looking for alternatives that aren't surgically based. They're looking for non-invasive but effective treatments, and that's what we found with Viviv. And in fact, where it came from, we initially did the trials looking at vaginal laxity and sexual response and found that we were getting statistical significantly changes above and beyond actually a sham. And I got to give the company credit for investing in doing a sham controlled trial. But from those trials that looked at sexual function and laxity, we found a lot of women were telling us that they were getting improvements in stress incontinence as well. So that's where we embarked on 2 studies. One is a 1-year follow-up and subjective data. The other study is looking at 6-month follow-up on its way to 12-month follow-up on both subjective and objective outcomes. And what we have found that with a single treatment, we're getting 83% of women at 6 months are saying that they're getting significant objective and subjective improvements in stress incontinence. And this really is the only technology that can provide those kind of results.
And how, you're a doc here, so tell us, explain the physiology of that. How is this, what is this tightening to help with the incontinence?
Exactly. There's lots of different energy modalities that you can apply to the vagina. You've got lasers, radio frequency, ultrasound. But in order to address stress incontinence, you need to get bulk heating. And you do that by penetrating deep into the vaginal tissue, into the lamina propria. The only way you can get deep enough with radio frequency energy is to have cryogenic cooling. So you cool the surface epithelium, allowing the energy to penetrate deep into the submucosa, stimulating the fibroblasts. Lasers are very superficial, and without the cryogenic cooling, you can not get the depth of penetration with radio frequency. So that's what makes this technology so unique. It's not only the radio frequency penetrating deep, it's the cryogenic cooling allowing it to go deeper.
Awesome. And Melissa, first of all, I think it's very cool. You're very brave coming in and talk about what is potentially an embarrassing problem, but you know, so many people have it. It's in this day and age, you can certainly talk about it. So. Tell us a little bit about your experience of having this treatment. You know, how do they do it? Is it painful? How many times do you have to do it?
Yeah, so it's about an hour treatment. It's completely pain-free. You can go back to normal day-to-day life right afterwards. You know, you can go out and exercise. Intercourse is perfectly fine. There's no downtime at all, right? It's completely non-invasive.
Okay, and that's awesome. And you did how many treatments?
I've had a few now, yeah.
Okay, and when did you notice like there was a change?
Honestly, a few weeks after my first treatment, for the first time since having children, I was able to get through an entire workout, jumping jacks, sprints, high knees, without losing any urine.
Wow. And the pathophysiology of childbirth, what does it do to the female urinary system? I mean, is it just the stretching and going back? I mean, do non-childbearing women ever have stress incontinence?
They do, in fact. I mean, all of us will lose collagen as we get older, so it's an age thing. But you're right, the physical pressure of vaginal delivery can cause stretching of both the fascia, the muscles, but also collagen loss. So it's a combination of those, but we actually see women who've had cesarean sections, never had a vaginal delivery. We see women who've never been pregnant at all will still have stress incontinence. So the market out there is huge. Laxity affects all women, whether childbirth or not, and so the market is a large one.
Now, are you saying there are other positive sexual improvements as a spin-off of having the incontinence therapy with your device?
Very definitely. The device was originally developed to address a functional issue in women's health, and that was vaginal laxity with a subsequent effect on sexual function, sexual response. So the initial treatments, the initial trials, in fact, I had it in my office for about 4 to 5 years, treating just the sexual response, vaginal laxity, and getting very good results. So the stress incontinence is more or less a spin-off of that. So the women who are treated with stress incontinence are also getting the added benefit of laxity treatments and also sexual response treatments.
So you have vaginal tightening, and when you say enhanced sexual response, I mean, does this have to do with moisture? Does this have to do with, I mean, what does it have to do with?
It's a combination of those. One of them is lubrication. Women will notice increased lubrication, but what the big one is improvements in arousal, because this is causing increased blood flow, and we're finding it's causing stimulation of the vaginal tissue that's allowing the frictional forces of intercourse to be transmitted through to the clitoral bulb. So what we're finding is women are re-engaging in intercourse because of the changes and the improvements in sexual response and sensation.
That's fascinating that you would have a functional improvement and then all these other great things. So we only have about a half a minute here. What's your target market? Who can use this device?
This target market is almost for every woman in Canada or the United States.
But I mean delivery terms, doctors. I mean, obviously women can use it, but can any doctor go out and buy this? Or
any doctor who is serious about addressing women's functional health and sexual wellness.
Not just OBGYNs, not just urologists.
Nope.
Your family practice guys, your surgeons.
Exactly.
Okay.
Anybody, cosmetic surgeons, dermatologists, plastic, anybody who has a passion to improve women's lives. That's who this is for.
Well, you know, I tell you, I learned so much sitting up here. You are doing a huge public service, talking about a potentially embarrassing subject. You are doing a huge public service, helping people. And in just one thing, you've been to the show before. You probably have never been here,
I
right?
have not.
What do you think about it?
I love it.
Yeah?
I love it, yeah.
You think you'd ever come back and walk around?
Oh,
and
you'll
look
see
at
me next year. Yeah,
See you next year?
definitely.
All right, and you've been here before?
Yeah, it's incredible. Incredible show.
All right. Well, listen, thank you so much, you guys. And tell us one more time, name of the company?
Viviv.
Viviv.com, all right, for urinary incontinence. And what do you call sexual enhancement there in your profession?
Sexual response.
Sexual response.
That's what we like to say.
Very good. Thank you so much for being with us, okay? And here we are, 2018 Aesthetic Show Live in scorching Las Vegas, Nevada at the Wynn Casino. This is a beautiful place, and I'm looking at all these people out in the audience, and I see my wife, April, and we have been here how many times? 8 times, 9 times maybe. And this is one of my favorite meetings because it's a show, okay? Everything else is a meeting. This is a show. It's fun. You learn a lot of things. We heard some good plastic surgery lectures today, and there's one of our lecturers out there with the great cowboy boots, and that was awesome. Okay, we're going to move on here. And we are going to have Restoration Robotics. Are they in the house? Which one of you guys is going to tell us about the robotics, Restoration Robotics, and what it is, what you do? Lay it on us.
As a company, we feel that our kind of strength, our 4 pillars are, we provide the world's most advanced technology to perform hair restoration procedures. We incorporate robotics, machine vision, machine learning, AI, you know, things you hear about a lot. But it doesn't stop there. We provide marketing support and we provide world-class training. So we have a whole team that comes into the practice upon acquiring our technology, and we help the physicians, whether it's setting up education peer-to-peer or helping them individually and their techs onboarding in this process. So it is a comprehensive training program that we offer.
When you look at the kind of the history of hair restoration, it started off pretty brutal. And then, you know, it got the little round plugs, and I mean the whole paradigm has changed. So let's talk a little bit. I don't know if Gabe and I would be the best patients for this technology, but
Joe, it's never too late. Yeah. Okay.
who are the optimum patients for the robotic technology?
You know, I mean, anyone who has some level of hair loss should be evaluated, obviously, by their physician. But patients can start losing their hair, obviously, in their 20s, so, you know, mid to late 20s, but all the way up into later in life. I mean, I had a hair transplant myself at age 54. So
well, that's a good one, because I wouldn't have known that.
Well, thank you. And so, and of course I had it done with our technology. So there is a large patient market out there. In fact, I just showed in a presentation a little bit earlier, in the year 2016, globally, over 635,000 hair transplant or hair restoration procedures were performed. So the market is in fact growing. And I think the other thing, Joe, is people are having an intervention earlier. You don't have to wait like I did till in your 50s to do something about your hair loss.
The technology is phenomenal. And you know, how does it know how to do that? How did you guys develop this where it could go to a certain area and do something and go to it's really amazing.
On the left side of the screen is the robot, is the artist system. And what it's done here is you can see tiny green lights. It's surveyed the field and it's locked onto each hair follicle in that field of view. It knows exactly which hair follicle it's going to take. It takes each one with purpose. It also knows that it's not to oversample an area. If you take too many grafts out too close together, that can have an impact, a thinning out spot, or even potentially a bald spot if that's performed incorrectly. The robot knows how to do this itself in a purposeful way based on the treatment plan. On the right is a manual FUE procedure. That is somebody wearing magnifying loops that has a spinning needle on the end of that instrument, and they have to line that up on every single hair follicle precisely, not only get the top of the hair that's sticking out, but get the root structure, base root structure, and the stem cells. And we're not talking 10 or 100 of these things in a procedure. It's typically thousands.
Walk us through kind of the average patient experience. I mean, do you get numbed for this? Pretend that I'm going into your office and I'm going to have my first treatment. What happens? Walk us through it.
Yeah, so usually there's a consultation process like common to most aesthetic procedures. Somebody would evaluate your hair loss. You're graded using the Norwood scale. And then based on the donor density, they look at what may be appropriate for you, age-related appropriateness, and then a treatment plan would be developed. We have an ability to do that actually on an application we created called Artist Hair Studio. So we can do that on an iPad app.
Yeah.
And so that's one thing we offer. But then the day of your procedure, typically you would come in, the hairline would be drawn in or planned in, and then that patient would, we would follow sedation protocol. There would be typically some numbing of the scalp, lidocaine injections, etc. And then after that, the hair is trimmed down, trimmed down short, and then the procedure actually starts. And we have the ability today to harvest approximately 1,500 grafts an hour with high precision.
Wow.
And so me having the procedure myself, honestly, I really had no pain at all. But after that step, and now with implantation or IX, we'll have the ability to take a 3D treatment plan and actually kind of, so to speak, send it downstream, and the robot will now actually make the sites and implant the grafts at the same time. So we're very excited about that. Since that's new, I've not had that procedure yet, but I look forward to having it in the future.
I hear people say, well, I'd like to get into hair restoration because that fits the paradigm of my practice, but I really don't know much about it. I mean, the doctor doesn't necessarily need to be an expert on this, right? You guys can provide the training and get the team up and running?
Yeah, we have a comprehensive state-of-the-art training. We train the technicians, we train the physician. There is always mentorship programs that we offer with other world-class leaders that can help them through the process. And obviously the Artas IX can harvest and make recipient sites and implant the graft. So it's definitely a huge help in the process.
We have always stated we provide an upgrade or upgrade pathway to our customers. So our customers are very important to us. So we provide updates as needed. Gabe's team works very diligently on developing these updates. Some are software related, some are hardware related, or a combination of the two. But we pride ourselves in providing upgrade pathways to our customers on a consistent basis.
Very good. Well, this has been very interesting, and again, we're talking about robotics and eliminating some of the human element and getting this space-age technology, kind of like the space shuttle. When I watch these videos, it's amazing. And thank you guys for coming by.
Thank you very much.
And Ryan, and we'll look forward to seeing you there.
Fantastic.
Out into the thing. And if somebody wants to get in touch with your company, how do they do that?
They can reach online. We're at www.restorationrobotics.com or www.artishair.com.
All right, guys. Thank you very much.
Thank you.
Appreciate it. Good having you here. Yo, Las Vegas, Nevada. Here we are at the 2018 Aesthetic Show, and we're having a blast, and we're talking to some world-class experts. I just gave a lecture on brow lift, and in that same session, Dr. Thomas Genevieve from San Antonio gave a really great lecture, which included mommy makeovers, which is kind of one of his specialties. Now, anybody that is alive and practicing in 2018 is doing something with social media, or if they're not, they're probably not very busy. Right. And brother, you've been doing this for a while, right?
Man, since 2010 at this 2009, I think I started getting into it.
2000. A lot of people didn't
yeah.
have computers in
Yeah,
2009.
yeah.
So tell me, what was your early stuff? What did you start doing?
So in the beginning, we started with Facebook ads, and then all of a sudden, Facebook Live, and then Snapchat and Instagram started integrating live surgeries. And I saw it on a few people, so I said, let's just give it a shot.
Correct me if I'm wrong, bro, but I heard you say today, you showed a clip. One of the things that he does that's really neat is when he does his breast implants, he has a little port that hangs out, and for a 5-week period, he can inject
custom. Can customize.
Well, yeah,
he can,
and it's pretty neat because the women are looking down, watching their breasts grow, and say, okay, that's good. Anyhow, I think correct me if I'm wrong, but you said you had 1 million views on that one little.
Yes, yeah, we have about, I think Inside Edition picked it up, and then the Daily Mail picked it up, so we have like 1 or 2 million views on the adjustments.
And you know, I recently did a otoplasty, pinned some ears back on a little kid, and it was kind of a heartfelt article.
Yeah.
And man, when one of those things picks it up, you get calls all day.
Daily
right? Mail,
whatever, Republican, the Rob Report, all those.
And you know, when I talk to younger doctors or people say, well, how'd you get on this or how do you get on that? One of the things, I want to know if you agree, if you're going to be a go-to media person, when they call, you got to be there.
You got to go to.
And if you're in the operating room, yeah, somebody has to put the phone up to your ear.
Oh man, the girls know 2 people can get me out of a room. It's either another doctor at an emergency room or the media.
There you go.
Then I just politely excuse myself and I get on that phone personally, and I handle the media personally.
If you don't do that, they're going to be on to the next person.
They'll leave.
Now, social media, is great as it is, as effective as it is, as cool as it is, sometimes you can run into problems. Have you ever had any?
I mean, that's the brunt of this talk, really, is I didn't know, but Facebook has a lot of rules. And one of them is you can't show nipples, you can't show the backside, and if you have music playing on the radio, you're effectively a radio station, and you don't have the copyright, so you have to put wording in there like, I do not own the rights to this music, and very, very specific things, and then I stopped getting kicked off. But it took me 21 times to be kicked off of Facebook before I got it right.
Only 21. Wow.
Only 21.
You know, most people are 200.
Yeah.
That's good. And,
Snapchat's easier, though. Snapchat's no rules, basically,
right.
almost.
Now, what market, age-wise, are you appealing to with your various, because you do a lot of breast implants.
Yes.
And that is a younger demographic.
Yeah. Well, you'd be surprised. I mean, at this point, Facebook is really the wealthier population. They're ready to buy. I call Instagram in between Facebook and Snapchat. Instagram's getting ready, kind of a year behind, and then Snapchat is your AAA ball. They're the ones that you're going to nurture into your practice. So they're a couple years behind.
You know, one of the interesting things is when doctors finish their training program right now, when I finished my training program, I mean, you know, it was all about your yellow page ad and going to emergency rooms and begging for patients. And it took decades sometimes to be busy. You might get a bone thrown at you by some of the guys down the street. However, I have seen many times a young doctor coming out of training, and they are very savvy with social media, and they can kick the butt of the busiest practitioner in the neighborhood.
That's true.
Right?
That's true. That's true. You've got to understand your audience, and you've got to make content for your audience without stepping over the line as well. As we have seen this happen just recently, we've had some line steppage. But when I first started, I thought it was more for marketing. But as I got through these surgeries, a lot of people would call and say, now that I've seen you do it, I'm not so scared. So it's become educational as well.
You know, another weird thing is when I first went into practice, even 10 years ago, April, my wife, you know, I'd be going to get a ladies' night out, and I was going to show some slides. She said, you can't show that picture. There's blood. You know, there's an incision.
Yeah.
And today, it's totally different. There's so many patients. They want to see exactly what
everything
you're going to do.
Yes.
And they're pretty savvy, and they'll shop around because you do maybe your type of breast implant or my type of facelift. It's amazing. So if you were talking, and again, you know, this meeting is very educational. If you were in a group of residents who are, you know, it's June and July 1st, they're going to leave and go out into practice. Tell that camera some pointers that you would tell them about establishing a social media presence.
I would say that you don't have to spend a lot of money. If you hire one person specifically as your marketing assistant, and then maybe use her for other things in the office until you get so busy that that marketing assistant will be on their own. I think you'll do better to have somebody to help you out, especially in the early phases. Now, we have a full-time marketing person now, but I would say use a marketing assistant, somebody in your office that is pegged to these kind of procedures and filming.
Yeah, and I mean, that's pretty much, in this day and age, especially in aesthetics, that's pretty much like buying equipment, right? I mean,
yeah.
you just have to do it. We have a little bit less than a minute here. You've been to this meeting before?
This is my first time. I'm very excited. What a wonderful meeting. I went to Vegas Cosmetic, spoke about a month ago.
Right.
This is my first time here.
And you know, it's so much fun because of the diversity here, the multi-specialty collaboration, and you know, cosmetic surgery at one point in time years ago may have been a very small group of specialties, but it has become so more ecumenical, and all of these different specialties bring something to the table for the greater good. And one thing about this meeting, everybody stresses science, because you don't want to go out there and be a cowboy and have bad outcomes. So anything else you'd like to say to our viewing audience today? And
enjoy yourself. If you're a plastic surgeon, you're getting started, enjoy the process of growing up. And if you're a patient out there, find a board-certified plastic surgeon or somebody board-certified in your neighborhood that you trust.
Thank you. And you know what? I talked to a lot of people, and I've talked to a lot of people this weekend. This guy is going to crush it. He's got a great personality. He loves what he does. Dr. Tom Genevieve from San Antonio. Thanks for coming to see us, brother.
Thanks.
All right, very good. And we're moving on here live at the 2018 Aesthetic Show in Las Vegas, Nevada. Now, our next guest is somebody who is pretty doggone important. And again, I am graced that I get to sit up here and talk to these world experts. And this is Neil Rouzier. Am I pronouncing it right, Neil?
Rouzier, that's fine.
Rouzier, okay. Je parle français un peu. And so I have been very active in the American Academy of Cosmetic Surgery, and I sit on their board of directors. And Neil has graced us many times with his knowledge and his lectures and his expertise. I have so many friends that are followers of it. He's kind of the messiah of you know, hormone therapy and everything. I mean, he really is. And this guy speaks. I've spoke on 6 continents. I don't know. You probably may have hit Antarctica before.
I haven't hit Antarctica yet, but I've been on all the other ones.
All right. So Neil truly is the father of hormone therapy, and it's amazing. So how long have you been doing this?
25 years.
And tell us about your start. How did this happen?
It happened serendipitously because I'm trained in surgery and I'm an ER doc, and I started off by treating some of my nursing staff, and I didn't know what I was doing. They were on hormones, and they asked me to do the refills for them. And they said that they felt much better on hormones, and I couldn't figure out why or how they could possibly come to that conclusion. But when I started listening to how well they felt and how well they functioned, and they didn't have the fatigue that all the other nurses have that were not on hormones, and they looked great too. And then I started reading and learning a little bit more about it, and then suddenly all the other nurses in the department also wanted me to prescribe for them, which I did. And then suddenly it spread like wildfire throughout the hospital. The Dr. Feelgood down in the ER would prescribe hormones for you and change your life. And that's when it all started.
That's very interesting. Now, you know, you hear some people just blow it off and be, oh, that's dangerous, you can't do that, you're going to get cancer, you're going to get this, and you're going to get that. But when you look, you know, there's so many females on hormone replacement therapies. What should males be worried about, or should they be worried at all?
There is a misconception about hormones. Unfortunately, hormones are naturally made in your body. When we're young, we have optimal levels of hormones. When we're older, we lose those hormones. Because of this Women's Health Initiative study where they looked at synthetic hormones causing cancer, everyone then extrapolates and assumes that all hormones are bad. No, what's bad is that you lose your hormones. What's beneficial is when you replace them. That's what I've been doing for 25 years. That's what I've been studying, reading, researching, writing literature on, and lecturing nationally throughout the world on this very topic. The world would be a better world if we didn't have the WHI trial and synthetic Premarin and Provera and all the synthetic hormones. Because people will say, oh, I don't want to take hormones, they cause cancer. Do you really think that I'm going to give you something that's going to cause cancer? Right. Do you really think that we're going to give you something that's harmful? Do you really think that if the hormones were so bad, would yank out your testicles and yank out your ovaries and yank out your thyroid when you were young?
Right.
No, we don't do that. So people have a very unfortunate misconception about hormones. They are very beneficial, particularly when you optimize them, and as you get older, you lose your hormones. We're bringing the levels back to what you had in your youth. That will provide health benefits, wellness benefits, aesthetic benefits, and that's why I'm at an aesthetics conference to let everyone know about the aesthetic benefits of hormones.
Right. So, you know, one of the things about this conference that is noteworthy and very important and reflective of the contemporary attitude of what's happening in cosmetic surgery is the improvement, you know, as form and function. So, obviously hormones can improve your appearance and they can improve your performance. So can you address how, like, your typical patient that comes in, like, what's improving? What are you giving them and what are you improving for them?
Let's look at health and aesthetics and then look at wellness and how you feel. You've heard and seen many doctors sit in this chair and talk about we can remove buccal fat, we can remove subcutaneous fat, we can remove a little bit of the love handle here. That does not get the whole entire body. That does not get the visceral fat. That's where our problem is the visceral fat. And all this other subcutaneous fat you can suck off here and maybe pull up here. What about the rest of you? What about the whole picture? It's really neat. You can have your buccal fat removed and have a little bit of lipo down here. But when you look at the whole picture, you really haven't seen a change. You haven't seen any change in how they feel or how they function. What we can do is change total body fat, both visceral fat, peritoneal fat, which makes you pooch, and subcutaneous fat everywhere else that you cannot remove. You can't suck out fat everywhere. But with the hormones, by optimizing metabolism, the metabolism results in you burning the fat. That's what's so important, and that's what not everyone understands. This is a whole body, I don't want to call it plastic surgery. This is a whole body remake. This is a whole body redo, because we can make sure that you maintain muscle. You lose muscle, your muscles sag. We can maintain muscle tone and your aesthetics, and we can get rid of the subcutaneous and visceral fat that your body develops as you get older when you lose their hormones. So from an aesthetic standpoint, that's what's so important. But there's no aesthetics procedure that you can do that will make you feel better. Well, yeah, I look better in the mirror. That doesn't make you feel better. That doesn't make you function better. That doesn't make you be able to work 16 hours a day and exercise on top of it. Nothing in medicine does that except optimizing your hormones and replacing all of your hormones that fall. Mm-hmm. That's the feel-good benefits. Right. That's the aesthetic benefits. And there's health benefits on top of it. People take blood pressure medicine, diabetes medicine, cholesterol medicine, antidepressant medicine for how they feel and all the ills that they get as they get older. There's a real nice study that came out in the Journal of Urology that says in these 500 men that they just followed for 5 years, 98% of them had complete resolution of their type 2 diabetes because we're getting rid of the visceral fat and they're off of their medicines. Right. That's wonderful. How do they look? Fantastic. How do they feel? Fantastic. Are they taking those medicines anymore? No. Over 5 years, that's the result of losing the visceral fat.
Gotcha. Gotcha. So now, obviously, you do this as a physician. Do you have a company as well here?
Pelicom is a company that's here that specializes in optimization of your hormones. Right. And we're here to explain how we optimize based on different methodologies. And one of the techniques that we use is pellets, or pellet therapy. Mm-hmm. So we utilize pellet therapy, and we have a special branded pellet that we use. In addition, we have developed an introducer for the pellets that makes it incredibly easy and simple. It's almost like giving a glorified injection. So any physician can do it. Whether you're surgically trained or not surgically trained, your PAs, your NPs can also do this in your practice. So any physician or physician's assistant can do this procedure. It's incredibly simple. It takes a minute and you're done.
And you know, and that's what's so cool about this meeting, this show, if you would, is that you have so many different kind of practitioners, and there's something for everybody. I mean, what he just said, physicians can do it, nurse practitioners can do it, and that's just one of the neat things that the Aesthetic Show brings together. We have about a half a minute. Is there anything else that you would like to say specifically to the audience about what you do and how you do it?
Dr. Enrique Jacome is in Palm Springs, Rancho Mirage, which is where I am, and we've teamed up to provide this therapy and this education for physicians. We provide courses to physicians to teach them and show them how to do all aspects of hormone replacement therapy. It's very simple and easy to do. All physicians can do it. NPs, PAs can also do it. It's very simple. We provide the training courses so you can learn what the medical literature is that supports it, how to do it, how to monitor it, adjust it, and it will be a life-changing experience for your practice, for you personally, but also for your patients. And I truly say, if you're not familiar with it, you don't understand it. It is life-changing for your patients and your practice.
Tell that camera right there how somebody gets more information about this.
You can contact us here at the Pelicom booth. If you wish to also contact us, you can call Dr. Enrique Jacome in Rancho Mirage. You can Google him or look him up on the internet, or Dr. Neil Rouzier also at the same facility.
Very good. Dr. Neil Rouzier, who I consider the godfather of hormone therapy, thank you so much for being with us.
Thank you, sir, for your time.
All right, very good. Hey, everybody, Dr. Joe Nyamtu here, live at the 2018 Aesthetic Show. Oh, thank you. We got applause. Okay, we're gonna keep going here. We're gonna keep going because I want to introduce Orden's video. Is that cool? We got time to do it? Okay. So we're gonna shoot to a live video here, and I want to say a couple things. This meeting, I've been here with my wife April probably 8 or 9 times, and there are really some constants at this meeting, and one of the constants has been Dr. Drew Orden, and everybody knows him as the host of the Doctors, the national television show. And when I first met this guy, I saw him walking down the hall and I said, oh, he's probably gonna be some stuck-up celebrity. He's the nicest guy in the world, and he has time to stop and talk to everybody and get a picture with him. And he has a Lifetime Achievement Award named after him. And tonight we have the TAG Awards. And so there's gonna be a winner of the Dr. Orden Lifetime Achievement Award. And Drew, you mean so much to this meeting, man. Thanks for doing all that you do. And let's cut away to a little video of Dr. Orden right now.
We are at the Aesthetic Show Live news desk, where we're going to be doing some great interviews this morning with some of the top aesthetic surgeons throughout the country. And I have this morning one of my very good friends, Dr. Andrew Orden.
Good morning. How are you?
I'm fantastic.
We've switched roles here. Usually I'm interviewing you on the Doctors.
I know, it's unbelievable.
This is your audition. We're going to see how you do.
You know how you got on this. I was the one that actually gave them your name for this. How good is that?
I owe you an assist there. But you've always been great on the Doctors. We always enjoy having you. You're cutting edge stuff. So let's take it away.
Well, you know, everybody wants to know about the history of the Aesthetic Show. Can you tell us? Because we know there's a long history there with you involved.
Well, there is. Who's counting? But I think it's like 8 years now that I'm the scientific chairman of the Aesthetic Show. And during that period of 8 years, I've seen it just grow and grow and grow. Obviously, it's a multidisciplinary type of meeting, which I like. Different specialties, but everybody has the same goal: to learn the newest in technology, techniques, tips, and trends. What I call the 4 T's.
It's true, and it's become super successful and popular because people from all over the country and world are coming here to learn the newest techniques from different surgeons of all different levels.
And you know, this meeting has a different flair to it than a lot of the other meetings, that it's not connected to a society per se. The dermatological societies or the plastic surgery societies, it's a meeting unto itself, bringing people from different disciplines, and I think that's what sets it apart.
Was that your original reasoning for this setup?
Well, you know, they had already set it up. It was like that. They brought me in as the plastic surgeon to add that twist, and sort of just to tie it all in together as the aesthetic or the scientific chairman.
How do you think this has evolved over time?
Oh, it's just growing, getting bigger and better and more complete, more thorough, better attendance, more exhibits. I mean, in every facet, we've sort of found a home away from home here at the Wynn now. I think it's 4 or 5 years, so I always look forward to coming back to the Wynn. Very comfortable, and they take good care of us.
What was the first meeting like?
You know, if I can think back there were still some things, some kinks that were being worked out, and it just wasn't as thorough. I mean, some of the original players that are still coming, some of the specialists that have always been a part of this group, were there, and they're sort of the forefathers, the pioneers so to speak, of the aesthetic show. They're still here. They make it what it is.
That's great.
Today.
What do you think people come to the aesthetic show for the most? What are they looking for? The glitz and the glam, like you talked about, some of the celebrity.
Well, that's part of
surgeons?
this show, is that we try to touch on that, the glitz and the glamour, that aspect of aesthetic surgery and aesthetic medicine. But as I said, just the latest technology, and my lecture in a few minutes in the welcome session is keeping up with the competition. It's a seasoned veteran like me trying to keep up with the up and coming guys like yourself. And I'm going to touch on that. I've been doing this 33 years. It changes all the time. I mean, back in the days, I'd run Yellow Pages ads and do that.
Crazy.
That doesn't work anymore. So, touching on that, it changes all the time. And what we need to do as committed physicians, practitioners in aesthetic medicine, what we need to do to keep up with the trends and keep up with the competition.
What do you think the other doctors and consumers are looking for now? Are they looking for the same things they did 10, 20 years ago, or has it just changed the way in which we give that to them, or are they looking for something new?
Well, I think people have always looked for the same thing. They want to look better because when they look better, they feel better. But it's just gotten so much more elaborate. There's so many different options, so many different steps that you can take as part of that journey. It's gotten a lot more complex. So we here at this meeting, next few days, we're going to address each one of those components.
Yeah, that's great. And that's, I'm sure, what you were talking about, keeping up with the competition. Nowadays, everyone can see everything.
Can we do a selfie now?
I would love to do a selfie. Make sure you tag us.
That'll come later.
Make sure you Insta-tag us. Make sure you hashtag us. Because that's what's happening nowadays. People can see things instantly.
Mm-hmm.
They want to see results. They want to hear what the newest trend is. And if it's not through their scroll, it's past them.
Exactly, and that's the way they're checking you out. Is this guy legit? What kind of results is he getting? Are his patients happy? And I'm going to touch on that during my session, keeping up with the competition. That you have to be social media aware and optimize and use that and use that internet and all those things.
There's no more yellow. I don't even think people know what the Yellow Pages is anymore.
No, it worked for me back then.
No, I'm sure it did.
I mean, those Yellow Pages worked. I mean, I always tried to keep up with the competition, and how I did that, I tried different things, print and radio and things like that. And in my Palm Springs office, we actually do a billboard, which works in that market. I mean, different things work in different markets. I wouldn't do a billboard in LA. I hear somebody just recently put one up on Sunset, plastic surgeon.
Yeah.
I have no clue how much that costs.
Well, I know a couple plastic surgeons that have all of Olympic. You go all the way down Olympic.
With billboards?
Every third billboard is theirs.
Really? Well, maybe they got the idea from us in the desert. In the desert it works, but.
Yeah, what do you think is the most important thing for patients that they want to look at and see before to find you or to go to you?
Well, I
think aesthetics, not just you, in general.
Well, I think we have found, you can do all this elaborate stuff on your website with your great credentials and talk about how wonderful you are. I mean, sure, that's a given. You want that to be part of the overall package, but they want to see results.
Yeah,
they want to see before and afters. And I'm going to touch on that during my talk, that you want to bring them into the process. You want to make it personal. You want them to become part of your family, that
I agree.
that you and your staff care about them in their initial treatment, but then ongoing treatment.
Yeah, lifelong.
Form that partnership, and if you do a good job of that, that's going to translate to sending you more patients, and that's still, I think we all agree, is the single best way to enhance your practice, grow your practice, get more patients, is through happy patients and word of mouth.
Yeah, I think that's what I was trying to get to, was that has never changed. The word of mouth, the local branding, the success through great before and afters has never changed, but now how people find those things and see those things as expand dramatically.
Exactly, and some of these back in the day when I was competing with the big names in New York City, the Dan Bakers, Sherelle Astons,
oh, yeah.
you know, we would never advertise, but
of course.
They had huge PR things. They did it in a different way under the guide, oh no, it's not advertising. Well, they made sure that they did certain things to get their names out there, and you know, it just continues to change.
Yeah, so it's great. Well, it was wonderful having you here.
We're not done, are we?
Yeah, that's how easy our talks are. We're just such good friends that it just flows.
It's always a pleasure.
I know. Is there any takeaways that people should take from you before going to see your morning session?
Well, it's just the meeting gets better and better each year. I'm excited to be here, excited to see colleagues, friends like yourself, and a lot to be learned here in the next few days.
Well, thank you for having me. It's always
My
a pleasure.
pleasure.
Feel very privileged and honored to know you. Great man.
Thank you.
Thanks
too.
so much. Good luck today.
Viva Las Vegas! I'll stop. All right, wow, what a great weekend this has been live at the 2018 Aesthetic Show. I have had the best time of my life, and this is the 8th or 9th time I've been to this meeting. I have had some of the world experts up on this stage talking about the latest and greatest things that happen in our profession. And again, if you could look down the hall and see this hustle and bustle, if you are a medical person or a staff of a medical person and you have anything to do or want to do with cosmetic medicine or cosmetic surgery, you need to come here next year, 2019. It is a show and a meeting, and there are people here from every specialty: internal medicine, emergency medicine, dermatology, oral and maxillofacial, plastic surgery, facial plastic surgery, ophthalmology, you name it, they're here. And the great thing is their staffs are here too, because there's so much about the business of aesthetic medicine and aesthetic surgery. I wish I had enough time to talk about everything. It's been a great show. It's been my honor to be here. Thank you so much. We'll see you next year, 2019. I'm Dr. Joe, and I am too. Thank you. Thank you.